So patients often come to me and say, I want to get some veneers or can we do some bondings on my teeth? And it really starts a discussion about their bite, how teeth come together, how that may limit whether we can do bondings or veneers or if we don't even need those things. So it starts a discussion, and then ultimately we get to a place where we might be doing a combination of things, changing the bite with the Invisalign and doing some porcelain veneers after, where we don't even have to remove any tooth structure from the patient. So it starts the conversation. People always hear this catchword veneers, but really we're trying to limit how much we have to take away from teeth in order to make them look the way you're wanting your smile to look. From a longevity point, if your occlusion is not right, if the bite is not right, neither of these things is going to last you forever, we'll say, right? Porcelain or resin on the tooth structure. If we get your bite corrected first, or if your bite's already in a good place, then there is absolutely no comparison between resin bondings and porcelain veneers. Porcelain veneers are a work of art in themselves. They are layered porcelains. There's anatomy in them. There are translucencies worked into them. We want teeth to reflect light back at you like natural tooth structure would. Resin veneers will not do that. Resin bondings will not do that. And resin bondings are going to be more susceptible to staining, and they're definitely going to break more often. And by the time you've had resin bondings done 2 or 3 times, you could have done the veneers once and had the smile you were really looking for. If you're looking for bondings on your teeth, I would urge you to take a closer look at doing porcelain veneers. Like I said, it's probably the most technique sensitive thing that we do in our office that's not surgical. So technique from the standpoint of setting the case up, from the lab technician fabricating the porcelain veneer to how we deliver it and how we taper it into the tooth. Um, Resin veneers just so you're going to miss so many of those things. And I would urge you, if you get to the point where you want to take that step, take a close look at the porcelain veneers as opposed to doing resin bonding. So our background is a story in itself. I mean, years ago we decided to go and do this right. I did a cosmetic case within the first 3 months of being out of dental school. I had never done a veneer, never prepped a veneer. I did a full case. I look back at those pictures and I don't like the case. The patient was thrilled and so happy because we made an improvement. But just learning smile design, proportion is such a big thing. If when people see a smile they like, they don't just see what color your teeth are. They see proportion within the smile. They see tapers. They see rounded or squared edges. They see so many things. And then within the tooth itself, we're trying to create anatomy that reflects light back to you that looks natural. There's so very much to it. And I'm going to tell you, the experience is where it's at. You know, I took all the classes, I went back and forth, I did all the training, took cases where we flew back and forth across the country doing cases. And I'm going to tell you, the years of experience in doing this is all the difference in the world to create a smile that fits you, that you're happy with, that you can take on the world and smile with confidence. You know, that's really in the hands of the lab technician as well as a provider that's done this. How many times have you really done veneers? Not just a porcelain crown. How many times have you done veneers to recreate a smile? When it comes to cost, when you're talking about doing a smile enhancement or makeover, whatever you want to term that, and we're talking about porcelain veneers, think about this. You wear these every day of your life. It's not like a new pair of shoes that you just love for a few months or a year, even, or your kid gets a new pair of shoes and they're worn out in the first 3 months. This is every day, all day, every interaction you have with somebody. So it's hard to kind of rationalize the price up front, but think about it. Every interaction you make, why go and do resin bondings on teeth when you could have the smile you really want, and over a short period of time you are going to see a return on your investment tenfold. Whether or not it's just how your grandchildren look at you, this is a huge one. How family members interact with you and look at you, and how comfortable you feel. Job interviews, daily interactions with the people at work around you, how you carry yourself. And it all starts with your smile. I mean, what better investment could you possibly make than to invest in some porcelain veneers or to redo your smile. It's hard to say, wow, those are expensive, but man, they really do pay for themselves. I would like to say that bonding is a good stepping stone. There's other things in life where, hey, you're going to try this first. If you like it, you're going to move up to the next thing. I can tell you, people that have done that with me, they're doing the bondings over 2 and 3 times. They could have just done the veneers and been finished, and they could have had a much better result. And when I do bondings, I do all the layers, I do the cutbacks, different resins, dentin resins, enamel resins, incisal resins, all the things. And in the end, it's just so inferior to what a really good lab technician can do with porcelains and what we can do when we put those in the mouth. So there's really no stepping stone. You want to change your smile? Jump in, do correct your bite, do the porcelain veneers. You're going to be happy. You're going to be much happier than just feeling a little bit better with resin bondings that you do over 2 and 3 times. The biggest misconception, and people just hear the term veneer and they're like, hey, let's just give me veneers everywhere. And so they're not always the answer, believe it or not. Sometimes it's just let's change your bite, let's move things around, let's broaden your smile with some Invisalign. You have beautiful teeth, let's just make them more visible. So they think sometimes this veneer term is just a catch-all and it fixes everything. It doesn't. It's just another tool in the toolbox of a provider that knows what they're doing, trying to create smiles. How do you learn that? It's experience. It's years of experience. Dr. Murray and I have been at this for decades. Literally, we have seen it. If I haven't done it and seen it, he's done it and I've seen him do it. So the experience behind what we're trying to tell people when they come in and say, let's just do some veneers. There's a lot more to it. It's more complicated, but we can make that simple for you. We can make it simple, as complicated as it actually is.